Adjustable Device for Airway Management. ADAM, a new airway management device. Airway disasters still happen, not infrequently. Direct endotracheal intubation may be difficult or impossible to be done fast enough to avoid damage to the patient. LMA, oropharyngeal airways, and other devices are used in cases of emergency airway or difficult intubation, but still may fail. Death or other severe injuries still occur despite the appropriate use of the LMA and other airway devices. Why do we lose airway? Soft tissues in the mouth become relaxed, heavy, and redundant after the patient loses consciousness. Soft tissues thus collapse into the mouth and prevent airflow from the mouth to the trachea. The insertion of an LMA, oropharyngeal airways, or any other currently available airway device may not overcome the collapsed soft tissues and allow the passage of oxygen to the trachea. Thousands of lives could be saved if an airway device, capable of predictably pushing aside the collapsed soft tissue in the mouth, exists. Adjustable Device for Airway Management, ADAM. ADAM is a device that allows to predictably push aside the collapsed soft tissues in the mouth of the unconscious patient. This allows an unobstructed pathway of the oxygen to the patient's larynx and thus to the rest of the airway. ADAM can achieve that by having a tube and two arms rather than one, which can move apart by twisting the tube after insertion in the mouth of the unconscious patient. A mask can then be inserted on the tube in order to seal the system and allow delivery of oxygen and other gases under positive pressure. Now you are looking at an animation that demonstrates how ADAM would be used on a life patient. Now you are watching a demonstration of an actual prototype of ADAM. These are additional pictures of ADAM. ADAM, Assisted Fiber Optic Intubation. ADAM can also facilitate fiber optic intubation. With ADAM in place, a fiber optic scope can be inserted through the tube while ADAM is allowing intermittent ventilation. ADAM's other features. The pictures shown earlier are those of a preliminary prototype of ADAM. Additions to the final ADAM device will include soft air-filled cushion to the edge of the anterior arm to minimize the risk of trauma to the soft tissues when the arms are opened. Air-filled balloon to the edges of the posterior arm that would cover the esophageal entrance, thus minimizing the risk of stomach inflation and regurgitations of gastric fluids into the mouth. A canal behind the posterior arm that can be attached to the suction catheter and eliminate the oral secretions. Atom FDA approval. Like the LMA, Atom is a Class 1 device, indicating that the risk of the product is low if used by appropriately qualified personnel. Atom is exempt from the FDA requirement for the submission of a pre-market notification. Now that you learned about Atom, please fill the short survey by following the link sent to you in the email. Please give your honest opinion.